Welcome back to Great Day Houston, everybody. All right, so if you find yourself having a hard time breathing, have constant sinus infections, or suffer from sleepless nights due to sleep apnea, there's hope. Our next guest, Darin White, dealt with all of that, but now he is breathing better, which means he's sleeping better. Deborah Duncan recently talked to Darin along with Dr. Pasha from Pasha Snoring and Sinus Center to find out how.
Dr. Pasha, behind this thing we call a face is a really complex set of things going on. And sometimes for people, it's one thing, sometimes it's several things, and your job is to get in there and figure out where it is and why it is.
That's right. And today we're going to talk about one of my very special patients and some of the complexities that he had, particularly with sleeping and also generally just breathing at night and also during the day, which, as we all know, is important.
Yeah, and Darin, you were sick a lot, and it just kept compounding and compounding. You would miss work a lot. It really impacted your quality of life.
It did quite a bit. I had lost my voice for about a month and a half. That was a huge impact because I'm a waiter and I couldn't go to work, obviously, for a month and a half. I was sick all the time, and I was really surprised I didn't get fired. But my company stood by my side, and when I reached out to Dr. Pasha, he could tell right away the symptoms that I had, what was going on. And thank God for Dr. Pasha. Otherwise, I don't know what I would have done without him.
Yeah, and Catherine, for you, watching this was difficult, and then even things like snoring at night could keep you awake.
Oh my gosh, yes. I was a skeptic to begin with, of all of this. But I learned that I needed to eat my words because I soon was having the same symptoms. But Darin is completely better. I mean, I have not heard him snore. He hasn't had a sickness in almost a year.
Wow. Dr. Pasha, oftentimes we joke that you're also a marriage counselor and you keep marriages together. All right, let's dissect this and look at what you did with Darin. As you mentioned, he had a number of problems. How did we fix them?
In Darin's case, he had problems breathing through his nose. He had, which caused him to have a lot of sinus infections, became a mouth breather, which increased his snoring. He had problems in the back of his throat, the way he distributed his weight, which again, contributing to problems sleeping because he was gasping at night. He was not just snoring, he actually stopped breathing. This is called sleep apnea versus someone who just snores. And sleep apnea is a bad thing because you need to breathe at night. So it's not just a snore, it's an actual gasp. Once we identified all these things, at the end of the day, what we really need to do is he had a major plumbing problem. He had a problem that began with the tip of his nose and extended all the way back behind his nose into his throat. And it was important for us to have an honest conversation of what exactly is going on and attack them individually so that globally he'll feel much better.
All right, so let's start with, you gave him an oral sleep appliance. A lot of people will use like a CPAP machine, but that can kind of get in the way. Tell us about the oral sleep appliance.
The first thing we actually did is make sure that he can breathe better through his nose. The other thing that we want to talk at least briefly is that he lost 25 pounds, all credit to him. We do have a in-house nutritionist, and part of that conversation is to also talk about people's habits, particularly their diet, and really address their weight in concert with everything else. But to your point, so he did not want to wear a CPAP machine, and I'm sure his wife didn't want to wear a CPAP machine. So the goal was to give him something that is much more manageable. You mentioned being a marriage counselor. I'm pragmatic. If you're married, or even if you're a bachelor or bachelorette, this is tough. This is a tough buy, right? So what we do a lot of is we've really invested into dental appliances, which is a lot less cumbersome. If you can see, we have multiple ways that we do these dental appliances. This is the one that we offered him. We've got multiple different ways of doing dental appliances, but the gist of it is that when you have obstruction in the back of your throat, particularly in the area as soon as you look back, the soft palate, and then south of that, a lot of that is supported by your jaw. And you see oftentimes with snores, when they're snoring, their mouth is open, and that's what causes a lot of obstruction in the back. So the jaw supports all the structures in the back of the throat. So what these dental appliances do is just basically it it tags the top of your teeth to the bottom of the teeth so it doesn't fluctuate back and then causing that obstruction point. And it's nice because you can put it in your pocket. You don't have to deal with all this hardware. And of course, it's not as cumbersome in the face, and it's a lot sexier. So this works, and it works rather well on select patients. But the key is, and Deborah, this is important, is that not everybody can qualify for dental appliances, and oftentimes if they don't, we can make them qualify for dental appliance like we did with Darin. And that's important because you see a lot of things on TV and these different devices that, if you're a snorer, if you have sleep apnea, this will work. Well, it's not for everybody. And that's very important to distinguish. And that's what we do in our office, is that we offer many, many different type of tools that is very specific to what will work for you, and not just a generic approach, which oftentimes leads to failure.
Catherine, you got a whole new man right now, and you start looking at yourself and thinking, okay, well, it worked for him. Now I can go in and look at some of my issues. What were your issues?
Well, my first issue was that I had to eat a little crow because I was so skeptical of all these surgeries and everything. And in the very beginning, when Dr. Pasha started, I just shook my head and I thought, oh, this is too much. This can't be right. And then when he got better and he got more better, and then, the best, and then I had to go back and think like, well, I snore. I'm pretty sure I've got sleep apnea. So I need to go and take a look.
All right, Dr. Pasha, girls don't snore. Actually, we do. What did you do for her?
So in her case, we'll probably end up dealing with the dental appliance also. We have a lot more options on her. It's not as severe. But let me tell you, this is a great couple. They're one of my favorite couples. This is the stories that I like. When someone comes in, has all these litanies complaints, and we're able to address them holistically, especially someone as motivated as this couple.
So when people walk through the door, you don't see procedures walking through the door, you see individuals walking through the door. And that's how you treat people, which is the reason why they get the results they do. All right, Dr. Pasha, this marriage has been saved. Thank you very much.
Thanks, Deborah. See you guys. Thank you.
To book your appointment with the Pasha Snoring and Sinus Center, call 713-523-8800. That's 713-523-8800, or log on to pashamd.com.